Hi, welcome back to our last chapter in Bio 23 Infectious Disease. Chapter 18, where we're going to talk about partnerships in the control of infectious diseases. The eradication of smallpox in 1979 stands as a public health triumph of the 20th century. This generation and those that follow will never know the horrors of this disease, other than through photographs. Several disease features of smallpox and its causative agent, variola virus, were unique in leading to its eradication and the development of criteria by which to evaluate other diseases as targets for eradication. Among these include that it has to be a disease found only in humans, that there are no natural reservoirs or biological vectors. The infection must be easily diagnosed. The duration and intensity of the infection is limited, and recovery establishes permanent immunity. A safe, effective, inexpensive, and easily administered vaccine must be available. And finally, that the vaccination results in a recognizable difference, such as a scar, that allows for detection of the immune individuals versus non-immune individuals in a population. All of these were true of smallpox and helped with the development of its eradication by 1979. There are many organizations that are partnerships in infectious disease. We'll start with those at the local level and build up from there. Every state has a Department of Health in the United States. Health departments focus on prevention of disease and the promotion of health and safety of the people within their jurisdiction. They watch for hazards of foodborne and waterborne diseases and establish and implement safety regulations pertaining to food and water sanitation. Public health restaurant inspectors can make spot visits to eating establishments and make sure temperatures for cooking and storing of food, that there is no vermin, such as cockroaches or mice or rats, that they practice appropriate measures of sanitation and hygiene, and that food workers are possibly even wearing disposable gloves. State health departments are required to notify the CDC of specific diseases so that a national network of surveillance and communication can be maintained. Vaccine campaigns and implementation of regulations requiring immunization against infectious diseases are other functions of state health departments. Local departments of health are involved in numerous other endeavors, including toxicology, vital statistics, public awareness health programs, water quality testing, prevention and treatment of drug abuse, cancer surveillance, and other things such as lead paint screening. At the national level, the United States has a number of different organizations to monitor, regulate, and control infectious diseases. The most notable of these is the Centers for Disease Control and Prevention, otherwise known as the CDC, which is based in Atlanta, Georgia. It is the nation's premier public health facility, and its impact is global. Its functions are to detect and investigate health problems, conduct research to enhance prevention, develop and advocate sound public health policies, implement prevention strategies, promote healthy behaviors, foster safe and healthful environments, and provide leadership and training. It was founded in 1946, and within its locked freezers are every known pathogen on Earth, including the most virulent and deadly, such as smallpox and Ebola. They've also kept some of these microbes alive or active in bodies of rabbits, mice, and monkeys. As deemed necessary, teams of epidemiologists from the CDC head into the field, frequently in collaboration with partnership agencies, and equipped with ready-to-go containers stocked with syringes, needles, vaccines, IV fluids, exam gloves, and refrigerators or freezers to store samples of blood and other tissues. The CDC's Building 15 is one of the very few known hot zones in the United States, where they have the equipment and facilities to research and handle Biosafety Level 4 or BSL-4 materials. The air leaving this building is passed through a series of filters, water is boiled before entering sewer lines, and the fortress-like building has cameras trained on its entrances so as to monitor anyone who enters or exits. Anyone who works in BSL-4 has to strip naked, shower, and don biohazard suits known as orange suits, and as many as 3 pairs of gloves before entering the lab. The air supplied to the researchers is done through a tube attached to the orange suit and is kept completely separate from the air that's in the room of the BSL activities. The CDC also has a vessel sanitation program. This was established in the early 1970s to minimize the risk of diarrheal diseases among passengers. All ships with foreign itinerary that carry more than 13 passengers and call on U.S. ports are subject to unannounced twice-yearly inspections by VSP staff. The cruise ship industry has been known to have a few outbreaks caused by norovirus infections. These include a very small percentage of infections on cruise ships, accounting for only about 0.18% of the passengers that are transported on cruise ships from the United States. However, because of the global media attention, these are still monitored and recorded, and prevention strategies are in effect. The best prevention strategies to minimize norovirus outbreaks on cruise ships is hand hygiene, or just washing your hands. Before you leave for a trip, you can always consult the CDC website to look for up-to-date travelers' health information, including the vaccinations required for traveling to that country, the availability of safe food and water, and any disease outbreaks in that country of destination. In addition to the CDC, there are other organizations that also play a role in disease control and prevention. Included in this is the NIH. The NIH stands for the National Institutes of Health, and it's a component of the U.S. Department of Health and Human Services. It originally started as a single one-room laboratory created in the Marine Hospital Service in 1887. Today, it comprises many thousands of locations and individuals, based, however, in Bethesda, Maryland. The National Institutes of Health are tasked with administering and supporting biomedical research, and in fact supply quite a number of research dollars to help fund biomedical research across the country and the world. The Department of Homeland Security, or DHS, is a much more recently developed agency. It was in fact proposed by President George W. Bush in June 2002 in response to the September 2001 terrorist attacks. Its mission includes many different things, but as far as infectious disease, it's in control and regulates the surveillance and monitoring of potential use of biological weapons. There's also the U.S. Public Health Service, or USPHS, that originated in the Marine Hospital Service in 1889. In 1891, it changed its service charge with being the nation's medical gatekeeper, providing medical inspection of arriving immigrants to weed out, quote, idiots, insane persons, persons likely to become a public charge, and persons suffering from a loathsome or dangerous contagious disease, unquote. It's taken a leading role currently, particularly during wars, in campaigns against sexually transmitted infections, immunization campaigns, vector control programs, and public health awareness programs. The mission of the USPHS is to improve the health of every individual by conducting research, engineering systems for safe delivery of water and disposal of waste, overseeing food and drugs, studying and developing means to contain or eliminate disease, and promoting a safe and healthful environment at work or at home. FEMA is another recent development of agencies in the United States that do play a role in regulating and controlling the outbreak of infectious disease. This is the Federal Emergency Management Agency, and it was created in 1979 by President Carter. Its charge is for natural disasters, such as hurricanes, floods, earthquakes, and tornadoes. These can destroy public health infrastructure, leading to polluted waters and compromised sanitation, followed by disease. The U.S. Food and Drug Administration, or the FDA, is part of the U.S. Department of Health and Human Services. It focuses on the safety of foods, vaccines, antibiotics, and other medical or biological products and medical devices. There's also the American Red Cross, or ARC, founded in 1881 during the American Civil War. It's a humanitarian nonprofit organization that relies on volunteers dedicated to helping people in need throughout the United States and in association with other Red Cross networks throughout the world. It supplies about 40% of our nation's blood supply and supports 5 critical areas, including people affected by disasters in the U.S., supporting military and their families, blood collection, processing, and distribution, health and safety education and training, and international relief and development. Finally, the U.S., we also have the Center for Infectious Disease Research and Policy, or CIDRAP. CIDRAP is committed to advancing the practice of public health through research, communication, education and training, policymaking, and forming interdisciplinary partnerships. Now, at the national level, the leading organization that promotes public health and control of infectious disease is the World Health Organization, or the WHO. This is important not just for developing countries, but also for the United States, because the planet's microbes know no boundaries and can travel freely using airfare or cargo ships and boat travel. The WHO is headquartered in Geneva, Switzerland, and is part of the United Nations. It functions primarily in surveillance and communication systems to track microbial diseases on a global level. It has, however, been known to support health care in a number of countries, especially in the front lines of those that need it. There's also the Pan American Health Organization, or PAHO, that's a branch of the United Nations World Health Organization and focuses on the Americas. Its role is to combat diseases and is committed to ensuring that blood for transfusion is safe and not a vehicle of disease. It aims to eliminate all vaccine-preventable diseases and was successful not only in smallpox, but also with polio, and declaring polio free in the Americas in 1994. Improvement of drinking water, sanitation, and healthcare remains a top priority for the PAHO as well, with a focus on equity. The United Nations Foundation, created in 1988, is a public charity and is focused on the eradication of measles and rubella and polio, looking to develop mobile health technologies, innovating health finance, and improving health for every woman and child. In the next section, we'll talk a little bit more about these international agencies.